evening, everybody. My name is Dr. Hussain. I'm a GP at BRADFORD Medical Centre and the current chair of BRADFORD City Health Federation. I'd like to welcome you all to our annual general meeting, in particular all the member practices, the GPs, clinicians, the admin staff. I'd also like to welcome all our partners. We have Mediscan Diagnostic Services, Dr. Naman actually attending today, as well as from the Clinical Commissioning Group and BRADFORD Airlines as well. As you know, this is our 5th annual general meeting, so well done to all of us to making it to 5 years, so well done. So today, there's a little bit of housekeeping before we start. We're not expecting any fire alarms. There is a fire exit just on my rail on the right and at the front over here. Toilets are at the back, up the stairs on the left-hand side. Okay. And to our viewers, I think we're live streaming this event to our City Health YouTube channel. So I'd like to say hello to our live YouTube viewers. Just be mindful, I know everybody's relatively well behaved in this room, but it is being recorded and it will be on the YouTube channel for viewing later on. So I think everybody's got the agenda papers. We'll probably just go through the minutes of the last meeting that we had last year. So just going through page 1. Page 2. Page 3. Okay. Is everybody happy with the minutes of the last meeting? I'm sure you've read them all. Okay, sign. Okay, brilliant. Okay, moving on. I think most of you are familiar in terms of who we are, what we do, but I think some of you are relatively new. So City Health is essentially a membership organisation, and it's a GP-led organisation. Its aim and objective is really to improve healthcare services for patients. It aims to deliver outstanding healthcare services for its patients, and ultimately it's accountable to its member practices. So it's very similar to the CCG in terms of improving health outcomes and tackling health inequality, but ultimately it's a membership organisation, so it listens to its members. And I think it's important just to recap in terms of our journey to how we actually got here. So in July of 2014, we had a meeting at Little Horton Lane Medical Centre where we invited a number of practices to come together. And in particular, we listened to our member practices. And some of the difficulties we had in City was that some of the practices were quite small and were unable to actually apply for services, community-based services. And we felt that if we came together, we'd have a much better chance collectively in actually delivering services at scale. But also there was a recognition that we weren't really mature enough in terms of delivering services at scale. We didn't have the governance, we didn't have the framework to actually deliver services at scale. So it's important for those original members that came together to actually collaborate and to build partnerships. So one of the first partners that we built was with Mediscan Diagnostic Services, who are here today. And that's quite important. And that theme has continued with Calderdale Hospital, with Avicenna, who are the providers for anticoagulation services and so forth, and with the BRADFORD District Care Foundation Trust and with the teaching hospital. So that was important. But I think also it was important to actually reflect and to listen to our members. We didn't have all the answers. We were, a bunch of member practices who had an idea that we wanted to deliver better services. So it was really important to listen to our member practices and to reflect and to learn and to actually acknowledge when we didn't really know all the answers and to evolve. And so we made constitutional changes. We engaged with our member practices. And over the number of years, we've actually expanded. So we now literally all the practices in the East City area of Bradford are members of City Health Federation. So that's 24 member practices, and I know some of the member practices are what we would describe as super practices with a number of practices. Here today, I think Kensington Partnership is one of them. So it's just really, it's been amazing. Really. It's been an amazing journey for us to actually do this together. Just a word also to say that the vast majority of the practices that are members of the City Health Federation are also members of the Primary Care Network 4, Primary Care Network 5, and Primary Care Network 6. Most of you will be familiar with primary care networks. For some of you who are here new, it's a new government initiative. There's always seems to be a new government initiative somewhere. And the idea is to have local clusters of between 30 to 50,000 patients in a network, collaborating and working together. And I'll talk a little bit about that later. Okay. I think it's really important, throughout our history was to engage with our member practices. So we've had a number of engagement events throughout the years. With regards to the primary care network evolution, we engaged with our member practices. A lot of member practices attended. We then developed the solution and the offer to the member practices. We had feedback from our member practices to say when it was right or when they felt as though that we need to make changes. And I think, overall, I think we had a very good solution to offer to our member practices. So engagement has been critical for us. Having a communication strategy on our website, engaging in terms of our networks, and also some of the quality improvement activities that we've been involved with in terms of collaboration. So one of the collaborative events that we had last year was with regards to developing a quality improvement and prevention program for diabetes, where we had a joint working arrangement with pharma to develop one of the only ones as a trailblazing project in the country. Dr. Gilkar and I recently went to an event which was hosted by Dachi Sankyo for an atrial fibrillation quality improvement prevention program, and they are looking at this as a blueprint for the country. Literally, a lot of pharmaceutical companies are looking at this and saying, how can we actually work with grassroots member practices like City Health Federation to deliver better services for their population. So I think, and that started here in City Health, so that's important to actually recognise. Talk a little bit about the backbone to the primary care network. The early conversation was, could one of the lead practices help and support and perhaps do the administration for a network? And the appetite wasn't there. In primary care network 4 it wasn't there, in primary care network 5 it wasn't really there, or 6. And I think City Health stepped up to actually have an offer to each of the primary care networks to say, we will host the clinical pharmacists, the social prescribers, the network operating officers, and actually try to be the backbone and help and support the primary care networks as they develop. And today we'll talk about a little bit later, but we have 3 network operating officers. We have Shaheen Hussain from Primary Care Network 5 over there. We have Charlotte Whittaker from Primary Care Network 4, and we have Adam Fenton over here for Primary Care Network 6. He's also doing our live streaming and doing our video editing as well, so he's multi-skilled in a number of areas. And we're also now recruiting an operations manager as well, to help and support the network operating officers. We've employed the clinical pharmacists, in Primary Care Network 4, 5 and 6. Each of them are actually adding invaluable to the member practices. We have Sana Nur over here, who's been helping and supporting Primary Care Network 4, and Farah in Primary Care Network 5. So I think all of these people have been recruited by the Federation to support the primary care networks, but we recognise it's not enough just to recruit them. You've got to recruit them, you've got to retain them, and you've got to develop them. And you've got to support them in their roles moving forward. And in April 2020, we'll have another social prescriber for each of the primary care networks. We'll have another clinical pharmacist and paramedics and so forth. And Dr. Gilkar will talk a little bit about that later. I think every year I've got up to say, we're going to get CQC registered this year. And ultimately, it almost becomes a goal for the next year. So I can say today, categorically, we are CQC registered. So City Health has become CQC registered. And it has been an arduous journey. It has not been an easy task, even for CQC, because they recognise that there's more and more federations in the country. It's a new phenomenon for them. So I'd like to thank Dr. Gilkar and the board for really helping and supporting in terms of ensuring that we get CQC registered. I think it's a really important milestone in our journey to develop all our policies. We have to also look at our systems and processes. And also, I'd like to thank Picton. I'm not sure if Anne-Marie's here today, but Picton were really helpful in terms of providing their support material that helps and supports us in terms of becoming CQC registered. It also allows us now actually to provide services at scale because we're now CQC registered as well, so that's important. We talked a little bit about quality improvement programs, and I've talked about AF. But one of the other programs that we had last year was a diabetes quality improvement program, and this was essentially a joint working arrangement between NAP and City Health and Medicine Academy. I think it's Charles here today, so yeah, so can we put your hand up for Medicine Academy? So that helped and supported the development of a quality improvement prevention program, and actually helped to improve patient care for our patients. So that was an important program that we had, and Dr. Gilkar will talk a little bit about that later. And I suppose I've talked a little bit about building the Federation workforce. We now have, as I mentioned, 3 network operating officers. We have the 3 surgical prescribers. We have 4 clinical pharmacists. And recently we've also procured a HR support and payroll services from Sentium to provide support to all our primary care networks. So that's quite important. Extended access. I think we were City Health was one of the first federations to really develop a collaborative model with Primary Care Alliance and the delivery of extended access. So currently at the moment we deliver extended access at the Picton Central Hub. We have GPs, healthcare assistants, and other healthcare professionals delivering services from our Westbourne Green Hub. And I think that collaboration has been brilliant for us, to be honest. And we're also in active discussions in how we can actually shape that in the future as well, in terms of the reach and the services that we're offering. And I think it's also important for all our member practices that have actually engaged with the extended access also. So in the future we are looking at potentially expanding the model to actually have a hub in Primary Care Network 5 or in Primary Care Network 6 as well, moving forward. So I think that's important. I think ultrasound diagnostic services, we'll cover that in terms of when we have our discussions around the partnership that we've had with Mediscan, and that has been a phenomenal success. About 400, almost 400 ultrasound scans are being done with our partnership with Mediscan services every month, and we know we can actually, and you know, it's down to choice from member practices. They can refer to these services. They're available in our member practices, and I think that's been a phenomenal success. And we're hoping to grow that with all the member practices, and potentially new practices that are joining. Warfarin Clinic, we have a partnership with Avicenna in terms of delivering of the AQP. We recognise there are challenges in this, in terms of delivering this, but I'm hoping that Akim can talk to us a little bit about how we can actually develop this service and move this forward, particularly now with the new primary care networks, and how we can actually expand this service to cover all the practices in City. So I think that's an important one. We talked a little bit about the quality improvement programs and new service development. So we have a collaboration with Mediscan around the development of a gastroenterology service. So we're having some discussions today. So we have a partner from Turkey, I understand, who's come today, who's procured a mobile endoscopy unit, and we have it. The mobile endoscopy unit is in Ashwell Medical Centre, and gastroenterology clinics are running from Ashwell Medical Centre. So, and the referrals are building. We are hoping that service can be an invaluable service to all our member practices. We recognise there's always delays in terms of getting endoscopy and also getting an outpatient appointment. And currently at the moment, I think when I looked at it last, we're able to almost literally get an appointment within 2 to 4 weeks. So that's fantastic in terms of as an outpatient service. And Yasser and Umar will hopefully talk about that a little bit later. Community dermatology services, I think this is a relatively new service. There's an AQP contract for dermatology services. We have a consultant, Dr. Javed Mahungu. He's a brilliant consultant, he's very enthusiastic. It's an AQP contract, again with City Health and Mediscan. It's hosted by Mediscan Services. Currently at the moment, the outpatient clinic is held at Clarendon. And Dr. Javed Mahunga has actually been instrumental in developing GPs with specialist interest in dermatology. So we have Dr. Tariq Aziz, who will hopefully be a GP with extended access very shortly, and Dr. Usman Saeed from Kensington Partnership as well. So that's a phenomenal success, and we're hoping that service will actually grow. And I suppose the other one was the RICS and the CLICS program. And the RICS is a reducing inequality program from the CCG. The CLICS is about central locality integration model. And City Health is actually engaging with that process with our partners in Bradford Care Alliance and our CCGs in trying to deliver an offer in that particular terrain and build on some of the work that we've already done with the social prescribers. An example is that we've already developed the primary care wellbeing templates for the social prescribers that are being utilised in primary care network 4 and 5 and 6, and that will help with the RICS programme in terms of the evaluation and moving forward. The network contract days, I think Dr. Gilcar will talk about that a bit later. I think it's really important as we evolve is to actually strengthen our governance. So currently at the moment we have 5 GP board members and we have 2 practice managers on our board, and they routinely meet every month to discuss matters. We're supported by Liz Noel, who's our administrator, who's here today. So, yeah, Liz, here you are. Sorry, I am a bit short-sighted. I've got this side, I have keratoconus, so on this side I can't see, on this side I can see. So I'm really sorry, it's nothing to do with this. You're here. Okay, so brilliant. So Liz has been excellent for us in terms of helping and supporting and really, ensuring that all the minutes are done in terms of governance and ensuring that the systems and processes are there. But also I think it's important to look at our governance and structure and say, can we actually improve this governance structure, what we've got at the moment? So we have some future ambitions of having a layperson on our governing body. We'd also have appointed Graham Sanderson to be our governance lead, to offer some scrutiny and some challenge to the board. And also, City Health has ambitions in trying to move some of the services from the hospitals to the community, and I suppose having a secondary care consultant would really help that. So we're really looking at our governance model, but also looking at the leadership and development of our board members to move this forward as well. So that's quite important. It's been a bit of a whistle-stop tour, but we've got lots of things to cover. So I'm going to invite Dr. Gilcar to talk through some.
Hello. I don't think so. I've got quite a few slides, but I'm not going to bore you with too much. I want to zip through them really quickly because we've got a lot going on tonight, and I just want to make sure that we cover all aspects. So the first thing I wanted to talk about was the primary care networks, which has been a real challenge in primary care. It's a new initiative that came out quite out of the blue, really. We have developed primary care homes, as you know, in Bradford. We were ahead of other areas. We've been running them for a few years, and suddenly the government learnt from that, and NHS England learnt from that, and rolled out the primary care network quite quickly and caught a lot of areas, out of the blue. But I think we were better prepared, and especially with City Federation having been established in the central locality since 2014, we've been able to run with it quite quickly. So the principles of the primary care network, I don't agree with Simon Stevens all the time, but I agree with this. He said that if general practice fails, the NHS fails, and I think we all know that and we all understand that because we're on the front end of the NHS. Everything goes through general practice, sometimes stuff that doesn't need to, but we're always there, we're always dealing with it. And when general practice doesn't work, the pressure is felt all throughout the system. So the principles that they've worked off is the 5-year forward view. I'm not going to bore you with the details of it, you can look them up. NHS long-term plan. As a result of that, there's a new 5-year GP contract, which is linked to the network DES, uplifts in your global sums, guaranteed, and also the increased investment through social prescribers, clinical pharmacists this year, next year, pretty much the same, and then paramedics, physician associates, physio. That's the kind of stuff that they're looking at, and it's really down to networks to see what will best suit them and what they need to recruit. So you've all signed the network contract DESs. So what you need to realise about this is that when you've signed that contract, and I'm sure Danny can confirm this, you're actually signing your GMS PMS contract to that DES. So don't think that your GP practice contract is separate from your network contract DES. It's not. It's one contract. So if a practice or if a network fails, all those practices in that network, their contract is at risk. You're failing your GMS PMS contract. So that's why it's really important that practices realise why City Federation stepped up to be the backbone of these networks, because they're crucial in terms of CQC, in terms of CCG assurance, in terms of NHS England assurance. And as Wahid mentioned, we did a lot of primary care network engagements because we felt that almost all practices in the 3 networks in the centre were part of City Federation. There were just a handful that weren't. But since this process, everyone in those central localities has joined City Federation. There's only one that hasn't, and that's Bevan Healthcare. But I think we can appreciate why they wouldn't. They're like a community interest company. They don't feel comfortable being linked to a federation. But that's fine. We're still covering their network contract there. And the aim of this is, at the end of the 5 years, this should lead to a truly integrated care system. And we've talked about it for years in City, and Akram is an expert in all the different types of integrated systems that the CCG and NHS England has tried to perpetuate, primary care home being one of them, as a kind of stimulus for it. But because it's coming centrally now from NHS England through the GMS, PMS contracts, through this network contract desk, and nationally in every area it's mandatory, I think we've got a real good chance of, at the end of 2024, actually having that integrated care system. So quickly, primary care network 4, 5 and 6 delegated the network contract desk to us. You all, hopefully you all remember your lead GP signing that and then handing it back to councillors. That's filed there. So your network has all signed that document, and on that document is City Federation as the delivery arm of your network contract desk. We have a population of 160k across the 3 networks. We've really gone for the recruitment. So a lot of areas, although the money's been there for these social prescribers, clinical pharmacists, and other in the future physios, the catch is that the government only gives you 70% of their salary. So where's the 30% going to come from? And in most areas, a lot of practices have not been happy to pay the 30%. Because you've got your own staff. Some of you have got your own pharmacists. So why would you recruit another pharmacist even though you're getting 70% of their salary? So that's been the stumbling block in other areas. But City Federation has stepped up to provide the 30%. So we are paying the 30%. So we're claiming the 70% from Karen and Debbie. We haven't claimed it, we can send you an invoice. We'll claim the 70%, and then the Federation, through its reserves, because of the income that we're generating from extended access, these quality improvement programs, the Mediscans, whatever income we've got, we are subsidising the 30%. So at the moment, it's basically 3 members of staff in each network. But eventually, by the end of the 5 years, it's going to be potentially 15, 20 members of staff. So that's a big responsibility to take. And so we as a federation need to be successful. We need to generate income that will help to support these 3 networks in the centre. And we want to recruit those people. So we have recruited social prescribers, clinical pharmacists. We intend to next year, April, recruit another social prescriber for each network, another clinical pharmacist. In the following year, 21, physios become part of the recruitment drive, paramedics and advanced care practitioners and physician associates. I've put a question mark next to physician associates because I'm not quite sure, through my ignorance, I'm not quite sure what they can do, they can deliver, but we need to keep that as a potential. And so what occurred to me was it's quite not easy, but you can recruit social prescribers, you can recruit clinical pharmacists. Where do we get the physios from? And where do we get the paramedics from if we're supposed to recruit these people? So we have been in talks with the Trust and the Yorkshire Ambulance Service about potentially having a gain share model or a collaborative model where they may pay the 30% if we do a job description for those people that cover some of their work, some of our work. So potentially that's something that we can develop in the future, and that's being led by the BCA for us, so it's happening across the area. So in the networks we've got 3 clinical directors. So we've got Dr. Hussain in Primary Care Network 4, Dr. Hakeem, who was elected to Primary Care Network 5, and myself for Primary Care Network 6. All of us attend a monthly clinical directors meeting because we've got 10 networks in Bradford, 3 in the centre and the other 7 in the other areas, district areas. So the 10 of us get together monthly and we try and find ways of working together. There's no point duplicating work. If something works in an area, it can be potentially shared with other networks. That's what we're doing. You attend your own monthly network meetings that are then followed by the community partnership meetings. So I think most areas, we didn't want to lose the community partnerships that we built up. So there's a network meeting and straight after there's a community partnership meeting. I think that's what's going to probably work in the future. We are preparing for extended hours and extended access responsibility for 2021 because in 2021 extended access, which is currently being delivered through the different hubs by BCA, that will move to the network. That service all over the country moves to the network, so we need to be ready for that, and we're working with the BCA in coming to a collaborative model that works for everyone. We've got our own System 1 module now for City Federation in anticipation of potentially extended hours access, but also our dermatology services, our GI services. So we've developed that now. We'll be able to then give it to our partners as well. So when potentially we have a dermatology clinic whereby Javed, he can write straight into the patient's record so you guys can see what's happening with your patient once they've gone to the specialist clinic. And we have been organising leadership training across the 3 networks for all the leadership teams, so not just the clinical directors, but receptionists, administrators, anybody that feels that they would like to step up to become a leader in this new network that have developed. Okay, so what is the point of this network? So this is what the government is hoping and will develop from these networks, and these are the services that they will expect you to deliver, and it's happening quite quickly. So we're talking from April 2020, all the networks should have a structured medication review and optimization for all your patients. So that's why we're recruiting clinical pharmacists. So a lot of the mesh work that used to be done, I think that is being decommissioned. So a lot of the mesh work will be moved to networks. A lot of the discharge summaries and face-to-face reviews that maybe some practices had pharmacists, some didn't. That work needs to be done at a network level and benchmarked and reduced variation and whatnot. There's going to be an enhanced health in care homes as part of the DES, so it doesn't affect some of practices like myself where they've just got a handful, but Kensington Partnership has a substantial number of care home patients, so there's going to be quite a tight DES that surrounds their care. Anticipatory care, so this is where you're anticipating patients whose care is maybe unstable and they're in and out of hospital and you need to wrap a personalised care package around them. Early diagnosis of cancer, that's going to be a push in networks because we've got very low rates of screening, as you know, in central city, especially for bowel screening and breast screening, and we have cases of patients being diagnosed with cancer after attending A&E and acute services, so that will be a big marker for us. And obviously diagnosing cancer early, so fast tracking patients appropriately and making sure they go to the right fast track department. And as I said, personalised care. The following year, they will expect networks to start delivering cardiovascular disease prevention and diagnosis. So I don't know what that means. I suspect there's going to be lots of initiatives and this is going to be flowing through it. So you can see as a practice, as an individual practice, it's going to be very hard for you to keep on top of this, and that's why working in a network and having the federation behind you to help and support you is really crucial. And I think we were really lucky to have City Fed around, and already that work had already been done over the years in building up the infrastructure and building up the engagement that we have with our practices. And finally, you will be asked to tackle neighbourhood inequalities. So you will have like detailed analysis provided by the Federation and also by the CCG and Public Health about your population, what the health inequalities are in your population, and they will be expecting you to fight don't look shocked. This is a 5-year plan, and they will be expecting you to tackle that and prove that you're tackling that. And now remember that your GMS PMS contract is signed to that. So it's important. You know, that it's not like the old days, we'll give it a go. If it doesn't work, you know, it's our population, it's our demographic. That's not really going to wash that, because you're working in a network and your contract is signed to that. Your own individual practice contract is signed to that network contract there. They will expect you to understand your population, fully understand the needs, and then develop a workforce and services to meet them. I think we're already ahead of the game in our networks because we've recruited the staff, we've got the social prescribers, we've employed these people, we're training them, and we're developing our networks, I would say, a lot faster than the other networks in at least Bradford anyway. We need to also work with other community providers, so we need to be talking to the hospital trust, the mental health services, social care, effectively the community partnership model that we've got. We need to be bringing that into the network. So I suspect that the networks and the community partnerships will then fuse into one being, whether they want to call them network partnerships or community networks, whatever you want to call it. I think that's what's going to happen. So the other program that we've been working on is so the other service that we've been asked to look at through Suhaila Abbas and Liz Allen, they've been working on the RICS and CLICS program. So the RICS is a substantial amount of investment in city practices. Because City CCG was underspent by about £8 million, when the CCGs were asked to merge, before we agreed to that merger, we asked as member practices and the City CCG board that £8 million was protected for city patients, so in the central locality. And that was an agreement that was agreed to. It's in writing. We've got an MOU. So whatever happens, we've got emails to confirm it, and we've got an MOU from our council members' meetings to confirm that that is protected, as well as our PMS, GMS monies as well. That's also there. That money was protected, but we needed to spend that in an effective way, because if you don't spend it, NHS England will take it back off you. So that's £8 million every year. So a lot of that is being spent in the community and improving services in the community, but the part that was parked for us was the CLICS program and the workforce development program. So the CLICS program, I'm sure Sahil's talked to you about it in the CCF meeting, but I'll quickly tell you what it's about. So there's an enhanced primary care element, which means that practices will be able to use that money to develop an MDT team. That means you're able to recruit a GP, a nurse practitioner, social prescriber, clinical pharmacist, and a team that builds those management plans for your complex patients that potentially are in and out of hospital or are housebound patients, put in a package of care around them. And that's going to be funded. So there's going to be funding for a GP, funding funding for a nurse practitioner, social prescriber, etc. And that funding will go from the CCG through City Federation or the BCA, whichever we choose, direct to the practices. So the funding goes to practices. The only condition, I think, because of the evidence behind this, is that it has to be 10,000 patients. So the smaller practices might have to group together with a few buddies, but it's got to be a minimum of 10,000 patients. So obviously, a practice as large as Kensington Partnership doesn't need to buddy it with anybody who can literally get funding direct. But say a smaller practice, say, I don't know how big Primrose is, 5.5. So you might have to buddy up with just another neighbouring practice or somebody that you can work together with, and then that funding will go to you guys directly. And it's quite a substantial amount of funding. For 10,000 patients, you've got, I think it's a part-time GP. So that's like four or five sessions. You know, that's a
0.1. So you'll get one session of it for GP, and then you get 0.5.
So it's 0.5 full-time GP for 10,000 patients.
Is that recurrent?
Yes. So and a nurse practitioner, don't quote us exactly on the figures, but it's roughly about 3 to 4 sessions of GP time, 3 to 4 sessions of nurse practitioner time. And so the details, we're working up the details, but that funding will go direct to practices. And that money and those staff that you recruit or partners that put that work in will be working around this model. And City Federation is going to help and support you in that, providing the template and the mechanism of delivery. So I think we bring a lot of added value to the Ricks and Clicks programme. The second part of the money will be going to the community development service, so that's the community connectors, the development workers, asset workers, volunteers. So we're looking at that and making sure that what we help and support is relevant to your network and what works for your practice. And then finally, I didn't really understand I think Suhail's going to have to give us more detail about this, is the actual infrastructure of how the integrated teams are going to work and how networks are going to collaborate. And there's some information that's going to come out about this, about the reporting mechanism that the CCG will want. I think they're going to make it as light touch as possible so it comes out of System 1 and the network directors collect it and report back. Our network officers that we've recruited collect that information and report it back. So we're going to try and make it as light as possible in terms of you guys reporting back, but we're going to have hopefully a template set up so that when you do this work, when we run the reports, you won't have to fill in forms and feedback forms that will just come out through the templates. So I'll skip this. I think Suhail's going to do a bigger engagement event about this. The second part of the RICS though is important. So this is workforce development. So this is 1.9 million pounds every year that's being allocated to GP development. So we have a lot of GPs in city that are locums and they don't take salary posts, and often they like the idea of working as locums. Sometimes same practice for a long time, but you can't develop a locum because you put all that effort and training and spending. They will then disappear. So practices have been finding it very difficult to develop somebody. But this program gives you the funding now to develop those locums, those salaried GPs, and even nurse practitioners and advanced care practitioners. So what Suhail and the CCG have said is that in these areas, if you have any GPs, locum or salaried, or advanced care practitioners, you don't get the pickup from GPs, that would like to be trained in any of these areas to become what used to be a gypsy specialist in cardiovascular disease, diabetes, respiratory disease. MSK was asked to be added on in pain management because it was a big issue with city practices. Any of those, you just need to put an expression of interest in, and their education will be funded. So the university diploma, masters that they do, that will be paid for. They'll get backfill for doing clinical sessions at the hospital. They're getting the consultants ready to provide that training. And this is a fantastic opportunity for you to recruit GPs or even advanced care practitioners that would like to make a commitment to your practice and to the city area by offering them the training in any of these specialities. So nurses can become advanced care specialists in paediatrics, say, if they've got an interest in that. And that could really help your practice and the networks as well going forward. So there's more information coming out on that, but I would really strongly advise you to find people that are interested and that would like to work at your practice but also develop themselves, and get them to put an expression of interest in so that we can start to collate those people. I think the expressions of interest are to go to get the Oxley? Yeah. Liz Allen and Suhail. That's you can always send it to us as well, we can forward it as well. Finally, extended access. So extended access currently is being delivered by the BCA through 3 hubs. City Federation delivers the GP, nurses and healthcare assistants at the Picton Hub, the Westbourne Rehab. We had to get CQC registered because it's our registered service, so we have got CQC registered in July, and we basically manage the rotas for the GP, the practice nurses, and the healthcare assistants. 99% of all the shifts have been filled, so we've been very successful in keeping the service fully manned on women throughout the whole last 2 years it's been running. And we've had really positive feedback from patients and carers about the service. They really loved it. Even the Saturday, Sunday clinics, which I was a bit shocked at, they appreciate having those clinics on a weekend, and so it has been well received. And as I said, City Fed fully delivers and manages that service. What we're hoping to do in the future, well, what we're hoping to do is that, as I said to you earlier, extended access and moves to the networks in April 21. So this current model that we have, BCA to set up, is not going to be viable in April 21. We need to plan ahead. So we've been talking to the BCA and collaborating with them, and we've got an agreement in principle that we hope that we'll be able to work through. So what we're hoping is that we're going to be able to combine the extended hours and the extended access clinics into one service, which is what I think the government will look at. That there will be 3 city-fed hubs, central hubs, 1 in each network, and that where that hub is the decision of your network, what works for your network. The central hub, though, PCN4, that needs to be open 7 days a week. Because from that hub is where the Saturday and Sunday clinics are provided, and they provide that appointments for the whole of Bradford. So we need to keep the central hub open 7 days. The others we can adjust. We need to maintain the BCS, mental health and physio appointments that are there, because that gives us a mix of appointments, and they're well received by the patients that use them. And we want to try and keep the principle that a patient in Bradford can book into any clinic anywhere at any time, because we want to maintain this service to all the patients in Bradford. So we're hoping to maintain that principle. But the city hubs, the 3 hubs in network 4, 5 and 6 will be delivered by City Federation in terms of GPs, practice nurses and healthcare assistant appointments. The principle that we've always, as you know, we've always done this, any profit surplus that is left from the extended access service, we've always given the whole amount back to the practices through extended access payments. So you've all received your extended access payments for 18, 19, that's just been paid out to the practices recently. All of it, minus, the management of the hub, which is very minimal in terms of like doing rotas and things like that, very minimal amount. All of the surplus goes back to the practices. That was the principle of City Federation, is that we don't want to pay any tax. This organisation is about generating income, and anything that's left, we reinvest it back to the practices. So we pass that money back to the practices for you to put back into your practice, or we buy equipment for the practices so that you've got something to that will improve the service that you provide to your patients. And really that's what's funded a lot of the stuff that we do. Any surplus we have, we pass back in payments, or we buy equipment that we think is relevant and give it back to you. Equipment is a good way of giving you reinvestment back without you having to pay any tax then on it. So it's a good way of investing in primary care. We've also been developing the QUIP program. So as you know, we've got diabetes QUIP, that program that is going around all the practices. I think Medicines Academy deliver it, and they've been through about 10 practices. So if you haven't had them knocking on your door, it's because we gave them a rest over the flu season. we understand the practices are busy at this time of year, but in January, Roman and his team will be knocking on your door to complete the diabetes, a bit like the AF QUIP that we did. So the diabetes, they will do the searches, they will do all the work, and then give you the actions to action, or you can let them do it, whichever you feel comfortable with. It also provides you with an audit for CQC. So when the CQC come, and we just had CQC recently, if you provide them with an audit of this work, it's pretty good work that Roman does. And when they will provide you with a full report of your diabetes patients and how to best manage them. So this is level 1 patients, so not level 2 or level 3. This is your basic core GP work. They will provide you with an audit, which when CQC sees it, they're pretty happy with it, and it's pretty. They do a very thorough audit for you. It's all nice guidance, and it's been approved by Medicines Management, Tracy Gaston, and CCG. She's been through all the SOPs. She's very happy with it, and in fact, Roman does a feedback report for her, and she's been really impressed with the work. She's looking to add other things to it, which we've pushed back on, because there's a lot of work in this quick program. I think she wanted them to start stopping test strips, and we didn't have time for that because we've got 24 practices to get round. So, but I think she's very impressed with it, and the CQC definitely will. And what are we doing? We're doing future QUIPs as well. So there's going to be a dyspepsia QUIP that will be coming around. Cardiovascular disease QUIP, which we're working up with Dr. Lindsay, Steve Lindsay at the hospital, and Bayer, with a collaborative, things are just working through that. We're also doing going to be planning to do a COPD, bone health, and vitamin D QUIP. So we just did negotiations. And all these QUIPs will happen over the next 12 months. And practices will be paid for engaging with the process, coming to the engagement events, getting their staff trained up by Roman and his team, and also then actioning any work that Roman highlights from that QUIP. So that's how you get that payment. It's kind of funded quality audit work in primary care. We've always needed to do this work, and often you have to do it in your own time. This is a way of getting it done by collaborating with a team like Roman's, and having your practice funded for engaging in it and delivering it. The audits that have demonstrated quality to the CQC and also for your appraisals as well. And we are also optimizing the prescribing in your network by doing this, because part of the network does is prescribing, reducing prescribing variance, improving the quality of your prescribing. This helps as well towards that. So all adds up to the body of evidence that shows that your network and your individual practice is delivering. And finally, the whole point of all this work is to reinvest back into primary care, because we understand, we all run practices, we understand that there's a massive demand in the system. The payment that general practice gets is pretty poor. Even it's £90 a patient all year to look after somebody for the whole year, and then also do baby clinics, also do diabetes clinics, also do childhood immunisations, also do flu clinics, also do this, also do that, work with these. It's not a lot of money when you think about the demand that we have from our community. It's quite hard. So any extra avenue of income that can be reinvested into primary care, we thought was really crucial. So We do payments for engaging in the QUIC program. So as part of the collaboration with pay practice to engage, coming to engagement and then coming to the training, actioning, working with Roman's team and then actioning the work. So there's that payment. So it's not free money, you have to do a bit of work for it. So it's quality work that improves the care of your patients. We bought equipment, so in the first year we bought the diagnostic sticks and then we bought the projectors for the practice. This year we wanted to also invest in practices. We bought iPads so that for each practice so they could engage with their patients and push the self-care agenda and collect positive feedback towards NHS choices and all that engagement stuff. And we've also paid back all the extended access payments in full back to the practices. And all the members who paid to join the federation have all had their loans paid back. So the original members, the original 18, had all their loans paid back a year ago. The new members like Kensington Partnership, Manor, Medical Practice, etc., those people who paid last year, we've paid them back all the investment. That's right, isn't it, Graham? You've got all your money back, haven't you? Last week. So we have paid, so we don't owe anybody anything now. So we are not in debt now to the original investment. So Avicen as well, they joined last year, all their investment is back. So every practice has had their investment back. The new members, we basically allowed them to join on the individual shares because now we need to move on and we need to start developing the networks. So this year we've decided to buy every practice wall-mounted ophthalmoscope and oroscope set. So every practice will get one of these today, which we're going to hand out. And this will hopefully, you can put it in one of your clinical rooms. And often I found that when I have them on the desk, they'd go walkies, batteries get lost. These are on the wall, they plug in, they're constantly charged, they're on all the time. Probably put it in the nurse practitioner's room because they use them more often, I think. GPs have them in their bag or in their pocket. I'll put them in your nurse practitioner's room, but it's up to you. So today we're going to be handing out those. So I'm going to pass you over to Jan, who's going to be calling out the. Who's handing out? Yeah. So shall we just call them out? So as we did last year, what we'd like to do is call out each practice, and they can then take their diagnostic set, and we can video it to show that they've taken possession of it. Because once you take it, it's your property. You damage it, you break it. You've got a year's warranty from Dean Healthcare, but it's your property. It's nothing to do with us once you walk out of this room with it. And it's all live on YouTube, so we know that you've took it. So first practice, please. If I could have Avicenna Medical Centre, please. Okay, next. Let's keep going. Dr. Usman, Hillside Bridge, please. Okay, Avicenna Medical Practice, please. Thank you. Barker End Health Centre, Dr. Usman at Hillside Bridge, please. Bilton Medical Centre, please. So they are from Dean Healthcare, so if you have any problems with them, they've been bought for you, they know that it's yours, so you just report a problem, they'll fix it for you. Bradford Moor Practice, please, Dr. Hakeem. Or Shaheen. City Practice, please. Not here. I will post it to them. Clarendon Surgery, please.
one per beat code. Eccles Hill Village, Dr. Hamdani's practice, please. That's fine, we'll post it out too. Family practice, please. Okay. Freising Hall Medical Centre, please. Grange Medical Centre, please. Kensington Partnership, please. There's a lot of practices in this federation, you know. It's quite expensive. You think like one piece of kit, but then you've got to multiply it by 24, it becomes very expensive. Anyway. Kensington Street Surgery, please. And Dr. Gilcott at Little Horton Lane. There's two separate practices, that's why. Two different beat codes. Lister Surgery, please. Lister Surgery? No, we'll post it out to them. Moore Park Medical Practice, please. Also known as Dr. Malik's. Park Grange Medical Practice, please. Not to be confused with Parkside Medical Practice. Not to be confused with Peel Park Surgery. Peel Park Surgery. Oh, Dr. Jones. Primrose Surgery, please. Dr. Raja Partners. Oh, yeah, we'll post it to them. I'll drop it off. I know where they are. Thornbury Medical Practice, please. I think he's going to the toilet. That's not Thornbury. No, we'll post it to them. And Valley View Surgery, please. We did say that if practices didn't attend the AGM, they wouldn't get their kit. But it's nearly Christmas, isn't it? So we're going to waive that. We should really give it to them. But I think, you know, some of them have got a mitigating circumstance, health and family issues, which you understand. So I think we're going to waive that this year, and we're going to actually hand it out to the practices that have not attended, because some of them have genuine reasons. Right, thank you.
So I'd just like to invite Yasser from Management Services to come up. A little bit of background actually. About 6 months ago we had conversations with Mediscan Services around an AQP service for dermatology. I think we also had discussions with other partners as well, trying to find the right partner for us for dermatology, and the board actually made a unanimous decision of choosing Mediscan Services as our partner to work on the dermatology. And to actually move it forward, it was really important because I think in the city we've got so many children, in particular when they have atopic eczema and other dermatological problems. And so for us, it was a real priority area. But also, I think we recognised the fact in city there was an unmet need. We didn't really have GPs with specialist interest in dermatology, and we really wanted to develop that and move that forward. So for us, it was finding the right partner to work with us, and secondly, also a willingness to actually develop the GPs in city to become GPs with extended roles. And I think the roles slightly changed as well. So we're really grateful actually. We've not had Dr. Javed Mahangu here today, but he's actually a brilliant dermatologist, and he's been really keen to develop the service over here. He's somebody who's got a track record as a consultant dermatologist, who's worked for Virgin Healthcare, and he's somebody actually was introduced to us through Amma, who's not here today. And he's taken a real keen interest in developing the GPs, Dr. Tariq Aziz from Little Horton, and also Dr. Usman Saeed from Kensington Partnership. And both are very close to actually becoming GPs with extended role. And that will actually add to our capacity and our capability in City to manage these contracts moving forward. And I think Dr. Gilcar talked a little bit about the other areas that we really like to focus on in diabetes and cardiovascular disease and other long-term conditions. But I think dermatology is actually another key area for us to actually develop our capacity and capability. So I think when I last looked, we had over, I think, 200 referrals, and you know it's quite significant in terms of the number of referrals at the moment. The one thing that's probably limiting us is the fact that we've only got 2 real consultant-led clinics in the month, and also we're training up the GPs within extended role. So we've actually didn't really want too many referrals into it because we just didn't have the capacity at the moment to manage all the demand. But I think moving forward, I think with Dr. Tariq Aziz and with Dr. Usman Said hopefully being accredited, and with other GPs who might be interested in dermatology, we're happy to, Dr. Javed has said as soon as he's trained these 2 up, he's happy to train other people up. I think we'll have more capacity and more capability of delivering it. And the model I think that we're looking at the moment is that if all the referrals to come in, so we looked at the model, and sometimes at the moment I think the referrals were going to Mediscan, and from Mediscan they were coming to us, and we felt as though that we wanted to have a System 1 module that at least when the dermatologist or when the gypsies or trainee gypsies are recording their consultations, at least all the member practices could see, you know, what is actually written, and there's communication there. So that was quite important. So at the moment, I think we're currently using the Little Horton Lane Medical Centre dermatology module. So essentially, it's electronically referred into that module. The patients are then seen at Clarendon Manningham site, and Dr. Javed Mahangu supervises those clinics. And I think the patient feedback that we've had has been absolutely excellent. It's been really good. So I think that's been a positive. I think moving forward, we've recently just actually secured our own System 1 module, which Dr. Gilcar talked about. So that actually opened us up really to be even more innovative than before. You know, it was actually limiting us. So we're hopefully going to have ultrasound services. We're hopefully going to have dermatology. We can have gastroenterology clinics, potentially extended hours on there as well. So there's a whole host of things that we can actually do now with our module. So yeah, and I'd like to thank Kasim also for helping, and Dr. Gilcar for helping us actually procuring this. It's not easy as a federation to get it. I think it took us probably about 12 to 18 months to getting our own System 1 module with all the hoops that you had to cross and all the things that you had to do. So that's on dermatology. I'd like to pass it on to Yasta, who's now going to talk about ultrasound services, endoscopy services, and some of the other things.
Thank you so much. At Mediscan, we are pleased to be partnered with such a vibrant GP federation, and it's like 4 to 5 years now that we are working in collaboration. So Dr. Wahid has explained the dermatology very well, so I'll be very quick on that one. Last year we have been inspected and we have been rated good by the CQC. So as a company, we are delivering ultrasound, dermatology, GI services, and in some other areas of the country we are doing audiology, MRI, and physiotherapy as well. So the recent development is that we have got our own mobile endoscopy unit, which is parked outside Asheville Medical Center. We are operating this on every weekend, Sundays at the moment, but we have capacity to do Saturday and Sunday both. So it's operational since mid of September, and it's every week we're running 10 to 12 patients or 14 patients procedures. Our GI services, we are doing from the consultation till the procedure, so you can refer your patients for the consultation, and after doing the consultation, our consultants, if they require ultrasound, we are providing one-stop clinic. That means that the patient has come for an OPD for GI services, and the consultant believes that we need an ultrasound, we have an ultrasound clinic in the next room, so the patient will go from one room to another to have the ultrasound done. So it saves the patient's traveling time, day off from work, or so it's a like one-stop clinic for the services. We are doing gastroscopy, colonoscopy, and sigmoidoscopy. And after the procedure, we do follow-up consultation as well. We have a dedicated GP line just for this service. So any referring surgery, if they need to ask have any queries about the reports or follow up for the appointment, we have a dedicated GP line. The numbers will be mentioned in the end of the presentation that they can call, and a dedicated person who is only for this service will be answering the phone calls and addressing all the queries. We are in process of getting our JAG accreditation done, so we are hopeful that in 2 months or 3 months time we will get the certification for the JAG. So all our procedures and our equipment are as per the JAG's standard. A little bit more about the service. It's commissioned by NHS. It's an AQP service. The waiting time from the referral, we book the patient in 2 to 3 days. Within 24 hours, patient will get the phone call from us, and within 1 week time, we book the patient for the consultation. Once the consultation is done, then we book for the procedure. That means from the referral date till the procedure done is totally 4 weeks, as compared to, if you compare with the hospital, it's like less than a quarter. It's a consultant-led service. We have 4 consultants with us. They all are experienced consultants working with the NHS. That's why we're running it on the weekends. And this one-stop clinic, as I mentioned, it's good for the patients and for the consultants as well, so they get the results quickly at the same day. So that's all for our endoscopy services. A very quick one, because most of you use us for ultrasounds already. So again, I'll be very quick on that. We scan with the patient within 5 days of time. The reports are back with the GPs within 48 hours. Maximum we provide weekends clinic as well. And we have a dedicated GP line for any queries regarding ultrasound scans. And as Dr. Wahid mentioned, we are scanning 400 plus patients every month from the Federation surgeries. And it's getting more and more. So these are our ultrasound clinics in the area. So most of for endoscopy, we are directly bookable as well on Choose and Book, and we will be our managers and myself will be coming to your surgeries to provide you with the electronic form of our endoscopy services, which can be integrated into your system one. So when you want to refer, you can easily find the form and it gets self-populated. So that will be done in days to come. And that's our email address for if you want to email the referral, just in case. So we have a dedicated email address for endoscopy referrals, and we are pretty quick on that. We give appointment within 24 hours. Patient will get a phone call that patients need to be booked. I would like to have Dr. Numan with me just for a couple of minutes, so he can explain from a doctor's point of view. I'm not a clinician, so he will explain a bit about the service, and then we move on.
Thank you very much. Yasir has already explained it very well. Just to re-emphasize that we have started gastroenterology and endoscopy services, and there is no waiting time. The patients are immediately booked. All these consultants which we mentioned, Dr. Naqvi is a consultant colorectal surgeon, Dr. Kareem, then Dr. Banerjee, and Dr. I forgot the fourth name, sorry. So there are 4 consultants which are working on this. Dr. Vinod is the fourth, yes. Dr. Vinod is the 4th consultant. So they are all working in NHS and providing services. We started on the weekends, but we have planned that once the service grows, then we will expand in other days as well, in the evenings as well. In addition, as I heard about from Dr. Gilkar, we can help you, the organization, as mashallah City Health is growing very well. So if you people need help from regarding physiotherapists or paramedics, we have also started our physiotherapy services, and we have our staff available. So we are providing in the whole Lincolnshire the physiotherapy services, and in the Manchester. So if you need, we can help you out in that part as well. And in addition, just recently we started recruiting nurses from Romania, Philippines, and Pakistan. So our first batch has arrived last month, and they have started working for us, and they are starting work with our company, and gradually we will place them in the hospitals as well as and the care homes in different countries. So if you people are interested, we can also work together in that part as well. So as I mentioned earlier, we have got our guest today is ex-Turkish Health Minister, Savaş Dobru. He's our partner. So he was in the transformation of health services for 8 years, and today he's here with us. They have got their own mobile factory. That's how when we made this mobile, this is actually now we are partners, so we are working as a partner. So they own their company, and not only endoscopy, we can make everything like CT scan, fitted unit, MRI, mammography, or any theater. So we are working on that part, and nowadays working in collaboration with the Turkish team to which can help us in England as well. Similarly, we have established, which may be useful for you guys, we established called robotic system. So with the Turkish team, which means that like ERS, you people do ERS, so you don't need to, no one needs to sit there. It's the electronic system, automatic system, robotic system, which books the patient automatically. So once in the night when we go home, the system is booking the patients, and in the morning when we come, all patients are already booked on they accept the referrals and they are selected in the system. So we have they have got a software companies, and we are working with them. So they developed our softwares for the robotic system, and these patients can be booked in the nights when we don't have the staff working there. So thank you very much, and I'm very much thankful to City Fed Health, because they always helped us, and they helped us to take first step when we started here in ultrasound. They helped us a lot, and gradually we progress in dermatology now, endoscopy, and other modalities. So inshallah we will move forward as well. Thank you.
We've not got Mr. Martin De Bono here today, but he was Calderdale Hospital Yorkshire Fertility was one of our other key partners, and currently they're delivering fertility services in partnership with City Health Federation. It originally started off as a assisted conception service, but it's more or less a general fertility service. It's currently hosted at the Clarendon side, and also I think they've got a partnership with Trust Primary Care and delivering the service at the Ridge Medical Centre. And I think it's an invaluable service, and if we look at it from an access point of view, from a patient access point of view, it's brilliant, and the patients are seen very quickly for concerns in this particular area. I think Martin's been here a number of times, and also their team has actually visited some of the local practices as well. But one of the concerns that they did have was that the fact that the fellows are, I suppose it's entirely up to practices how they refer, but he did mention, he said that the referral activity is getting a little bit lower, and which is potentially means that they may not be able to continue the service, which is a viable service in the city. So I think it's important for us to, if we don't know the service, then perhaps you have it as one of the options as a practice, as a network. It's a fertility service. It's, the waiting times are literally 2 weeks and the patients get seen. The vast majority of the activity is done locally, and if they need something else, something more specialist or scanning and everything else, that's done at their Halifax unit. So that's probably what we wanted to say. We can share the referral data with all the member practices so they can all have a look at it. Okay, that's it for now. I think I'm going to hand it over to Jangir now, is it, for the award ceremony?
That's fine. I think they can hear. This is the exciting part, to have the prizes and everything. Just to describe the selection criteria we had for these different awards. This is the second year we are doing the award. We asked you to nominate people through emails, and responses were a lot better than the last year. There were 4 judges, including myself, and if somebody was nominated from the practice of that judge was not supposed to give any selection for that particular category. It was pretty close. There were 2 ties in 2 roles, just going to give you a brief description so that you know what kind of practice this is. So around a year ago, this practice was related inadequate for CQC. Despite feeling low and deflected, the team came together with patients and the community and worked tirelessly to turn the situation around, improving access, systems and processes, and achieving its best ever score in the national questionnaire. In April and July this year, re-inspection showed how the team had worked together and turned the fortunes around to achieve an overall rating of good in just 9 months. And this is ever seen a medical practice. Well done. It's heavy.
It's heavy. Do you want to?
Where's the one when you need
The
it?
main man is hiding. Do you want to come over to a quick photograph? Akram, I think you should come forward.
Yeah, actually, Paul Sal's work, so I just do the credit.
All done. I'm 10 there out running it, so I'll come this side. Nicole, do you want to come in? As you see, we've got a very professional cameraman here using a City Health iPad. Thank you.
Next is GP of the year. So this doctor has served the practice and the patient population with the utmost skill and professionalism, always putting the patients first. Their abilities allow them to, I'm trying to tell you, to work with the patients all ages, and their effectiveness knows no age bracket. They're always ready to go the extra mile, and they're adapted to any given situation, be it long hours or last minute home visit. They are never failed to deliver. Their professional approach, together with their endless commitment and dedication, mean they are highly suitable to receive this award. And it's Dr. Adnan. Okay, let's do a picture. Very fine, but he was not the judge, okay?
It's not part of the panel at all.
He wasn't. It was myself, Graham Sanderson, Elancia, Liz Knowles, and the fifth one we have to ask Dr. Ryder to decide whether there was a tie. So none of the judges, they were from the same practice. The third one is the practice manager of the year. This practice manager has been there for 13 years. They started the journey in general practice as a receptionist, progressing due to their work ethic, enthusiasm for learning, dedication, and professional development to be a competent manager. They frequently work beyond the call of the duty. Among their many qualities, they are extremely organized individual, and they have a wide skill set, including but not limited to data management, IT and innovation, financial record keeping, management, and human resource. They are very keen to develop the team and have supported people at all levels in their professional development. And they are Qasim Ananzai.
I think you should get in this one.
their entire career to the surgery, working with the practice for over 25 years. They always give their 100% to the patients and the practice, and never complain about their workload and anything extra from their way. They are a humble person, takes patient care to another level. They are amazing relationship with their patients and always go the extra mile. They come attached to and they committed to them. I mean, they have attached to the patient and committed to them. And it's Don McGregor, any of you?
Well done.
Fifth one is the HCA of the year. They are enthusiastic, motivated, and have a good rapport with the patients. And there's a great advantage in engaging them and promoting better self-care. They joined the surgery just over 2 years ago and work in the community as an FCA and went out of their way to arrange training in the skills needed to equip them as an FCA in general practice. They run the clinics with the support from the clinicians, but they have some level of their autonomy. They will try to provide a holistic approach to all consultations and proactively give the extra care and checks patient need. When they certainly appreciate and the practice has benefited in seeing many of their calls and their targets being achieved. And this is Claire Lord from Criminal Surgery. One is the administrator and receptionist of the year. They are officially the data quality manager, but they have developed in other jobs as well out of their role, and they're supporting the practice and the practice manager without any hesitation. They organize staffing in holidays, they handle the complaints, and also take the role of being managing the nurse and SCA staff rota for the extended access provided by the City Health. Their role extends to support for further surgery, a branch surgery, and they ensure that there is calm to the chaos in the practice, and they are faithful advocates.
Big moment.
The last one is the collaborative partner of the year. I think last year it was medicine.
Can't win it every year.
Well, this partner is a great collaborative partner, and they have well-led local organization with a portable and helpful leader. Joining the Health Federation, they have worked hard on QFP projects, especially diabetes, and will be working on a range of future joint products. They have engaged effectively and positively with the member practices, and they are providing quality orders to them. And that is helping the practice with the CQC inspections and the reviews. And it's Medicines Academy.
Okay, I'd like to thank you all for attending our annual general meeting. It's been an amazing event. You've all braved the cold and the parking issues and everything else. So thank you very much for attending today. We will have a closed session, so all the practices that they really need to stay, because I know Richard is going to do the accounts and actually present it. So it's important for you to attend this part of it as well, please. So the member practices, particularly the member practices, really need to be in here. The partners, they'll be happy to. We'll be happy, they can leave. But thank you very much. We'll just give a round of applause to everyone. Thank you.